Hi, this is Mark Adajar from XSculpt, where we level you up. And I wanted to make this video today to talk a little bit about gynecomastia. I'm driving in my car, so I'm trying to be a little bit more time efficient. It's been really busy for us. It's freezing cold here in Chicago, which explains the get up. So the question I'd like to answer today is, can gynecomastia be treated with diet and exercise alone? This is a common question that I see on the forums and I get in the clinic. Now, to answer this question appropriately, there's a lot of variables that you have to consider to determine if it's possible. The short answer is yes, it is possible. However, the longer answer is, like I said, it depends upon a lot of variables. The first thing you want to keep in mind when you're trying to determine if you can get rid of your gynecomastia with diet or exercise is to find out, number one, if you have true gynecomastia or pseudogynecomastia. Okay, so true gynecomastia is when you have both breast gland and breast fat on your chest or fat around the breast gland. And that's true gynecomastia. Pseudogynecomastia is when it's just fat and there's no gland. Okay, you more often see pseudogynecomastia in patients who are overweight or obese. True gynecomastia is more common when you have gynecomastia that starts in puberty. And now this is important to determine the difference between the two, because if you have true gynecomastia, no matter how much diet and exercise you do, you will not get rid of the breast gland component, because breast gland is not composed of fat. It's composed of breast glandular tissue, number one, and fibrous stroma, or scar tissue in layman's terms. And so you may reduce the volume of the breast because the breast fat surrounding the breast gland will go down, but the breast gland itself will never go away. So depending upon how big your breast gland is, you may have the fat will go away and you'll have either pointy nipples, or you'll still have a breast mound, but no breast fat. Okay. Pseudogynecomastia, since it's all fat, definitely with a solid diet and training program, it is possible that if you have pseudogynecomastia, it will go away. Again, because in pseudogynecomastia, it's just fat, there's no gland. However, in my experience, because pseudogynecomastia is usually seen in patients or people who tend to be more overweight or obese, there's almost always a small breast gland component. The reason being is because the enzyme aromatase that turns testosterone into estrogen mainly resides in fat cells. Because the patients are overweight or obese, there's more enzyme to convert the testosterone to estrogen, and subsequently estrogen forming breast glandular tissue. So the breast gland might not be that big at all. Maybe hopefully it'll be very, very small, and with diet and exercise, your gynecomastia will reduce enough to a point where your chest still looks great, but again, in my experience, there's almost always a little bit of a gland. There's always a little bit of gland, but it might not be significant. So point number one is that you have to determine if you have true gynecomastia or pseudogynecomastia in order to know if you can get rid of your gynecomastia with diet and exercise. Oh, and by the way, usually a physical examination by an experienced surgeon can determine if you have gynecomastia or not. But short of that, usually your primary care doctor can order an ultrasound of the chest, and that will show if you have gynecomastia or not. Mammograms can do it, but guys don't usually get that. It's usually an ultrasound. So an ultrasound ordered by your primary care doctor will determine if you have breast gland or not. and that will be the definite answer that you have true gynecomastia. Okay, the second thing you have to determine, and I alluded to this earlier, is your own genetic potential to lose the fat from your chest area to reduce your gynecomastia. Again, assuming you have pseudogynecomastia, not true gynecomastia. So, as you know, we're all built a little bit differently. And a lot of guys are able to, when they go on a diet or they train, they're able to lose fat just like that. Unfortunately, a lot of us, including myself, it takes a lot of work and dedication and persistence and consistency to lose weight or to get your body fat percentage down. So that's something you definitely have to take in consideration. Is that, are you one of those people who can genetically do that? There are some guys out there who will sweat and work out like crazy, and no matter what, they'll get bigger, but they won't get cut, they won't get ripped, their body fat percentage won't change, or their body fat percentage will change, it just doesn't come off the chest or the love handle areas, which believe me, I know is very frustrating. So you have to keep in mind your own genetic potential to do that, and after that, of course, your ability to maintain it. Some guys, can do it, and they get their body fat percentage down to like 8, 9, 10%. However, if you've ever tried to do that, like I have, it's very, very difficult to maintain a body fat percentage at that level if you're not just built that way to do so. I just tried to see if I could get myself under 10% body fat, and I was able to do it for a good 2 weeks, except that I was just eating broccoli and chicken and drinking water the whole time, and I was hangry the whole time. It was not a fun experience. I was getting headaches. It was just very difficult to do, and there's no way I would be able to maintain that for any significant amount of time. So you have to be realistic in your expectations about that you'll be able to maintain that for a significant amount of time. And again, and unfortunately, when you do gain the weight back, your body will store that fat first in the core, and your gynecomastia will get bigger, or will return. And if you do it wrong, you'll be worse off than you were when you started, because of metabolic damage that you've done to your metabolism, but that's a whole other story. So again, number 2 is your own genetic potential. You have to consider regarding being able to get your body fat percentage down and maintaining it. A third variable to consider is, and this is something that you can definitely control and educate yourself in compared to the first two, is that your own body's response to diet and training. Now, in general, like I said, you cannot spot reduce fat from a certain area. That's just not, it's not possible. That's just not how we're built. Like, for example, if again, you can do as many side crunches or sit-ups, and your love handles won't go away, or your spare tire won't go away. This is just, you can't. It's just a well-known fact. You cannot spot reduce. You reduce fat when you change your diet and exercise all over your body, equally. You definitely will build musculature in those areas if you concentrate on it, but your body fat percentage in that specific area won't go down. So my point is, you have to be on a very good training program, and whether it be a lot of cardio or weight training, resistance exercise, HIIT training, coupled with a calorie restricted diet, in order to get your physique to where you are happy with. Now, I wanted to mention that, not all people respond to all exercises the same. For example, like person A may do an hour of cardio and get awesome results. Person B may do the same amount of cardio and get no results or minimal results. However, maybe individual B or guy B will lift weights and get great results, and the same and guy A may lift the same amount of weight or lift weights and not respond as well. So you have to keep that in mind, is that not all exercises work the best for everybody. You have to find out what exercise training or exercise program or training program or mix of different programs work best for you, and how your body responds to it, A, and B, it should be something that you're consistent with, something that you enjoy and that you can do pretty much for the rest of your life, as much as possible, as consistently as possible. So that is something to definitely keep in mind. Same thing with diet. They always say the best diet is the one that you can stick to, right? So it won't do any good if you do, let's say, keto. You have a great response, and you stop it after 3 months because your HDL bottomed out and your LDLs went through the roof, and your primary care doctor had made you stop it because you developed fatty liver and tightening of your coronary vessels. So that's not a good thing. So I think personally the best thing to do is just eat as clean as possible. Just eat a small to moderate amount, and make sure your energy expenditure or your calories out is greater than your calories in. Of course, it's not the fastest way to do it. It's not, and you won't get results, within, 3 months. But for the, research has shown for the long haul, it's the best thing for you. It's the most durable, and it's most likely it'll keep you healthiest. It'll keep you healthy for the longest term. So I think that there are a lot of fad diets out there and crash diets, and no doubt they do work in the short term if done properly. However, again, you do get the problems from once you come off the diet, the weight will come back, number one. Number two, always have to remember that some diets will cause you to crash metabolically, or cause long-term, if not permanent, metabolic damage, where you can't, your physiology is so messed up, and your hormonal state is so jacked, you end up gaining weight, and then you cause so much damage. You're just always gonna suffer from weight gain or inability to lose weight. Okay, so that's important to remember. So I hope these points answer the question if you can lose your gynecomastia with diet and exercise alone. In reality, it is very difficult to do. However, it's not impossible especially with determination, hard work, sweat, blood, and tears, and the proper education on how to do it. So, good luck to you if you are on that path to doing it. It's not impossible. I have seen it done, and if you can do it, more power to you. If you have tried and for whatever reason can't succeed, or you have true gynecomastia, seek the help of a surgeon. If it's causing you significant anxiety or stress, and always, the surgeons at XSculpt can definitely help you. That's our specialty. Come and look us up. Call for a consultation. We'd be happy to talk to you, and hopefully we see you at XSculpt and we can level you up. All right, take it easy.